Member for Bullwinkle.
Thank you, Speaker. I rise today to speak on behalf of the people of Bullwinkle about the Appropriation Bill. So an Appropriation Bill might not sound terribly exciting at first, but it is one of the most important pieces of legislation that the Federal Parliament will pass this year. In simple terms, it's the government's budget bill, the legal authority for the government to spend money from the Consolidated Revenue Fund. So Labor's Appropriation Bill reflects our priorities and our Labor values. It shows us what matters to us most, and these are some of the things: investing in Medicare, aged care reform, housing, renewable energy, cost of living relief and education. They give legal effect to our budget commitments and allows the government agencies to spend the money accordingly. In short, Labor's Appropriation Bill is the legislation that puts our budget into action, and it authorises the government spending in line with the values that I mentioned and others. I come to this parliament with a range of experiences. I'm a nurse, midwife, occupational health and safety consultant, a small business owner, a lecturer in nursing studies at TAFE and ECU University, a community volunteer, a Shire councillor, a PhD candidate, and now, of course, as an MP. Speaker, the first half of my career was as a remote area nurse and midwife in the Pilbara and Kimberley regions of West Australia. I had the privilege of caring for people in remote Indigenous communities such as Ardaloon, Lombardina, Bidjadanga and Luma, small Aboriginal communities. And it was in these communities that I first saw the true impact of a model of health that you may be familiar with, what we call the social determinants of health: access to fresh food, local employment, education, housing and connection with country and culture. They're not just abstract ideas, they're real, measurable factors that affect the health and well-being of a community. And they're not just unique to health. The same principles apply to justice, social determinants of justice, and the social determinants of mental health. And when these social determinants are addressed, people and communities are healthier, safer and more resilient. And that's why I'm proud to be part of the Labor government committed to improving these social determinants. And I'd like to speak about a couple of them. I'll speak to three of these issues. So housing, education and health are all priorities because we know that investing in these delivers real outcomes for Australia. So let's start with housing. From October the 1st, 2025, every first home buyer will be able to purchase a home with just 5% deposit, and they won't pay a cent in expensive mortgage insurance. For many young Australians, this could shave years off the time that it takes to save for a home. For example, somebody buying $1 million home could do so with just $50,000 deposit, backed by the Albanese government. This is a change that brings hope. Owning a home will no longer be a privilege just for the lucky few or those that have been helped by the bank of mum and dad. It'll be achievable for hard-working Australians across the country, and that's the Labor commitment to give everyone a fair go. Education is another cornerstone of social investment. We have made fee-free TAFE permanent, so Australians can gain the skills that they need for a well-paid, secured job. Fee-free TAFE is already helping Australians get ahead while easing the cost of living pressures. It gives people the opportunity to work in meaningful jobs and give back to the community. We've also cut student debt by 20%, and with the Commonwealth Practical Placement Payment, it provides support for student nurses, teachers, midwives and social workers while they're on their mandatory placements. These programs ensure that our future important workforce can contribute fully and confidently without being burdened by the crippling debt. And of course, health, which is always at the forefront of my mind, personally and professionally. The Albanese Labor government went to the last election in 2022 promising 50 Medicare urgent care clinics. They over-delivered 87 clinics. For this election, we've also promised to open 50 more across Australia, and I'm thrilled that one of them will be in my community in Bullwinkle, in the suburb of Mundaring, to cater for the Hills people and the regional people nearby. These clinics make it easier for Australians to gain urgent access, urgent care, free of charge, and taking the pressure off hospital emergency departments and, of course, GP clinics. Our goal is for 4 in 5 Australians to live within a 20-minute drive of a Medicare urgent care clinic. That's the kind of change that makes a real difference in people's lives. Alongside that, we're delivering the largest investment in Medicare in history. This means 18 million more bulk-billed GP visits every year, giving Australians the confidence to see a doctor without worrying about the cost. When someone falls ill, when a parent is concerned about a child, or when an older Australian needs ongoing care, access should not be a barrier. Of course, Labor created PBS, and our commitment, the Pharmaceutical Benefits Scheme, our commitment extends to these medicines as well. In 2023, we delivered the largest cut to the cost of medicines in the history of the PBS, and we're going even further as of the 1st of January next year. No Australian will pay more than $25 for a PBS prescription. For pensioners and concession card holders, we've frozen the PBS medicines at $7.70 until 2030. No surprises, no rises, just certainty. I know from my own life that this is extremely important, and many people that are on medication simply aren't on just one medication. They're often on multiple medications. It's making a real difference. I became a nurse when I was 18, following in my mother's footsteps, and being a nurse quickly teaches you that affordable medicine can be the difference between seeing somebody get better and somebody ending up in hospital. I've seen people skip doses because the cost is too high, and I've seen the consequences. That's why cheaper medicines aren't just good for the pocket, they're good for health as well. Health is something very close to my heart and one of the favourite topics when I go door knocking out in Bullwinkle. And one of the most exciting things I talk about is delivering the new Medicare urgent care clinic in Mundaring, but also alongside that, a new Medicare mental health centre in the suburb of Kalamunda, also in the hills of Perth. Because we've recently set up a Medicare mental health centre in the regional area of Northam, and that was opened late last year, and we've seen firsthand how valuable it is for locals. It offers free walk-in services for people aged 18 and over, a safe, welcoming place to access mental health and from qualified professionals. No appointment is needed, no referral is required. You even don't need the Medicare card. You can just walk in, seek help for yourself, supporting a loved one or assisting a patient. And that is universal, compassionate care, and it's exactly what we want for Kalamunda and for communities across Bullwinkle and Australia. Mental health is just as important as physical health, and no one, once again, should face the barriers. And Speaker, first-hand life experience also plays a role, and I didn't need surveys or focus groups to see the impact of these services. I had a very personal experience with a Medicare urgent care clinic just last week, so I'll just quickly tell you a little bit about that. It's not a prop, so it's a legitimate splint on my finger. Right, so I injured my evening just the night before I was meant to come to Canberra, and with a silly incident of ripping my sock off extravagantly, and I also ripped my tendon off. Oh dear. But this is how it went. I went to, it was an obvious deformity. I went to an urgent care clinic. I waited 5 minutes, saw a triage nurse, saw a doctor, went 5 minutes up the road to the X-ray department, waited 5 minutes, had the X-ray, went back. By the time I went back, the doctor had my X-ray, he had assessed it, and then I waited probably another 5 minutes while I got a referral for a proper splint, a customised splint, some analgesia for the pain, and obviously the splint.
I'm very
Total
impressed.
1 hour. Total 1 hour. Able to come to Canberra happily the next day. No charges, no delays, just quality, accessible care. And I wasn't the only patient in there. It was just an efficient service. And all I needed was my Medicare card. And that experience isn't unique. I'm proud to be part of a government that invests in these services: housing, education and health. I'm proud to be part of a government that understands the social determinants of health, that improving these factors and the other ones that I mentioned earlier in the speech is the most effective investment that we can make in our communities. And it's why Labor's Appropriation Bill matters so much. It translates into real, relatable impacts on people's lives. It's the parent who can take their child to a doctor without worrying about cost. It's the student who can pursue a nursing career without crippling debt. It's the young person who can own their first home with hope and security. And it's the community that has access to mental health support without barriers. And for me personally, it connects directly back to my life and my career. From my earliest days as a nurse in the remote communities to my work in occupational health and safety, volunteering, serving on the Shire Council, I've always seen the importance of putting people first. I've seen the difference that accessible services, compassionate care and real investment can make in people's lives. We will continue to work on expanding Medicare, improving access to the urgent care and mental health services, lowering the cost of medicines, making housing more achievable and supporting education and skills for all Australians. It's a reflection of our values, our priorities and our vision for a fairer, healthier Australia. And I'm proud to be part of the government that invests in people. Speaker, I will continue to work every day to make sure that the healthcare, education, housing and support services are accessible, affordable and compassionate. I will continue to advocate for the social determinants of health because I know from experience that when we get things right, communities like Bullwinkle thrive. It's about people, Speaker, and it's making life better for every Australian. Thank you.